Good morning, everybody. Apologize for the little bit of a late start. A little bit of a technical challenge when you get everybody who's going to be presenting who's kind of stuck in a green room and you all are waiting in the auditorium. So in any event, thank you for your patience. We are going to go ahead and get started with our seminar a couple of minutes late, but again, thank you for your patience. So welcome everybody. Yesterday was technically the first day of fall, and it sure feels like the first day of fall here in the Treasure Valley, and I think hopefully across most of the state. A little cooler in the morning with nice warm temperatures. It's not quite done, as usually happens in Idaho. We got a few warm days left, but we are on our way, and this is, of course, the first week of fall. And I just wanted to mention that here in Idaho, we do a Falls Prevention Awareness Month, which is all of September, because we have so much information that we want to share with everybody. Nationally, they only do Falls Prevention Awareness Week. So if you hear anybody talking about Falls Prevention Awareness Week, that's the national campaign. Of course, there are a lot of good things going on. We, in the meantime, are right in the midst of and almost done with Falls Prevention Awareness Month. If you can go to the next slide, please. My name is Erin Olson, and I am a program specialist with the Idaho Commission on Aging. A couple of years ago, when I became the Health Promotions Program Specialist and realized that there was a falls prevention effort across the nation, I decided that Idaho really needed people were doing things about falls prevention. But there really was no coordination. So we started the Falls Prevention Coalition of Idaho, or FPCID, which is now a program under the Idaho Commission. As I said, I also mentioned the Disease Prevention and Health Promotion Program for dealing with things like diabetes and chronic pain and all of those things that often occur for people who are aging. We're going to talk a little bit more about chronic conditions as we move on through. But I wanted to mention that ICOA, or Commission on Aging, is funded by the Administration for Community Living, and the national organization that works with falls prevention is the National Council on Aging. So some of those you might hear of as you are listening to different things, and we certainly thank them for funding our efforts to give you the knowledge, the skills, and the strategies to help prevent falls. Next slide, please. Got to do a few logistics. We'll get through it really quick because our wonderful expert presenter, Kyle, has a lot of good things to share. If you have questions while he is presenting, then please use the questions panel. For those of you on a computer, it's kind of the bottom center of your screen. You can ask your questions when we get to the end. Time permitting, we will answer as many of your questions as possible. Next slide, please. All righty, what about resources? Everybody else wants to know, can I get a copy of the slides? The good news is you should have access to the slides right now, as well as after our seminar is over. If you see on the bottom right side of your toolbar a resources button, and you click on that, it should open a pane on the right side of your screen. There is a documents tab or a documents link in that pane, and under documents is our copy of the slides. Now, that same option will be available if you come back into the lobby like you did when you joined this morning. Just use that same link. There is also a resources button there. So after the seminar is over, you can come back and you can get a copy that way. And also in a few days, we will be putting a copy up on our website. Now, everything you ever wanted to know about the FPCID, or the Falls Coalition, as well as Idaho Commission on Aging, and especially our falls efforts, can be found at www.aging.idaho.gov/falls, FALLS. That includes links to our next two seminars that we have coming up, as well as all of the resources from the past seminars, and much, much more, including our full resource library. So be sure to check that out. Next slide, please. As you probably all heard, we are recording this seminar. We will have a copy of the recording available on our YouTube channel probably a week or so from now, after we're all done, so we can get it uploaded. Also get an almost immediate email from Zoom Events telling you that the recording is available again here from the lobby. So just click on that link, it'll take you back to the lobby and you will see a copy for the recording. Again, you can get the slide handout there as well. But in a week or so, we will have our recording available on our YouTube channel. That is, of course, youtube.com. Most people know how to get there. And then our handle is Idaho COA. Idaho spelled out, and then the letters COA that stand for Commission on Aging. So Idaho COA, that's actually our handle for all of our social media. So if you'd like to follow us on any of those other social media platforms, feel free to do that as well. Next slide, please. Now, this next one is the stuff that nobody ever likes to talk about. It's our emergency plan. We hope, fingers crossed, nothing goes wrong, but we are dealing with tech. So we know that anything can go wrong. If you get kind of a stuttery audio, the best thing you can do is log off and log back in again. Usually that fixes whatever those kinds of problems are. If we lose our panelist, well, then we're just going to be patient and hopefully he will be able to join us momentarily. I will fill the minute or so until he can do that. If we have a bigger crisis and we lose power, the internet goes out, something like that, then of course we will need to schedule and we will let all of you know via email when our technology today and everything is going to run perfectly well. So next slide, please. What are we going to talk about today? Well, in the next hour or so, we're going to talk about overall health and well-being. I like that, getting into kind of that big picture instead of some very specifics, although it does deal with some specifics. We're going to talk just a minute or so about ICOA, the Falls Coalition, what our focus is. Then we're going to learn a little bit from our expert. What about aging in the US? What does that look like? What about social isolation? And then aging and infrastructure, how does that impact each other? And then finally, of course, community-based interventions. What are the things that are available in our communities that can help us have a long, healthy, happy life? As time permits, we'll have time for Q&A, so don't forget to enter your questions into that questions panel available from the bottom of your screen. Next slide, please. So before we get into the speaker, I always have to do my part to say we are Commission on Aging, we are the Falls Prevention Coalition of Idaho, and how does all of that fit together? So give me just a minute or so, a slide or two, and we will get started with the main part of our presentation. Next slide, please. So I just wanted to let you know that to simplify the risk factors for falls, because there are a lot of them, and again, a lot of strategies that we have to reduce them as well, the Falls Coalition, or the FPCID, has come up with 4 pillars of falls prevention. First is nutritional health, then we have physical health, emotional health, and finally, environmental safety, because healthy aging and falls prevention are not just about us as individuals, but it extends out to our communities as well. I'm going to do a quick slide specifically about some of the emotional health issues and impacts of falls, and then we will turn it over to our expert. So next slide, please. So the first question is, what is a fall? And I'm sure we all know a fall when we see one, right? Except sometimes we don't. So for our purposes, when we're talking from a public health standpoint, from a health care standpoint, we need to know what a fall is. It involves unintentionally move downward, typically rapidly or freely without control, from a higher to a lower level. Simply put, that's it. Okay, so we don't plan it. We're either standing or walking, and then we're moving lower. Now, that doesn't mean to the floor necessarily. It could be onto a chair. It could be into a wall. Put your hands out to catch yourself. That's what we mean by a fall. And we're kind of combining that with the causes of falls, which often are trips and slips. So a trip in itself, a slip in itself, is not a fall. But if it causes us to move and we're not really in control of ourselves and we somehow hopefully catch ourselves, whether we hit the floor or not, that is what we are calling a fall. So with that common understanding, let's go to our next slide, please. So one of the most important parts, I shouldn't say they're all important, but one of the parts that often gets overlooked is the emotional impact of slides. And I'm not going to talk a lot about this because Kyle is going to do so in just a few minutes. But I wanted to show you a picture of what is known as the fall cycle. And that is when somebody falls, then of course they're more aware and more, I'd like to say aware, but in some ways afraid of falling again. Sometimes if that is too overwhelming, then they stop doing things. They stop participating in physical activity. They stop doing things like cleaning the bathrooms or cooking because they're afraid they're going to fall doing so. That then starts the cycle. I've fallen, I'm afraid of falling, so I'm doing less physically and socially. That means that my muscle tone and my balance and all that stuff worsens, which makes me more likely to fall again. Once a person falls once, their likelihood of falling again immediately doubles. And that doubles and that doubles every time they fall. So you can see how this gets to be a cycle, and it really is more of a downward spiral. On the right of the slide, you see many things that happen when people get into this cycle. I'm not going to talk about them though, because Kyle is going to address these, but they are laid out for you here in a single slide that's just going to help support Kyle when he starts speaking rather. Next slide, please. What we need to know is very simply that holistic health, good health, means all of those pillars that I talked about. And it's kind of like a car. Some people look at it that way. If you have a flat tire and even one, you're not going to be able to be as effective driving that car as you would. Same thing with driving your body. So I would like to go to our next slide, and let's just get to our speaker today, who is Kyle. I like to go to different conferences and events. I get to meet different people. Go ahead and go to our next slide, please, because this is where we get to meet Kyle. I met Kyle, about 3-4 months ago, maybe earlier this spring at a conference. I had done a presentation that he attended. He did a presentation that I attended, and we found out that we had common interests and common goals in mind. So I'm going to introduce you to Kyle and let him take over talking to you about a little more about who he is and what he does and how it is kind of intersecting what Commission on Aging and the Falls Coalition is doing to prevent falls and promote health in Idaho. Take it away, Kyle.
Thank you so much. Thank you. Go ahead and go to the next slide there, please. Great. Yeah. So again, my name is Kyle Weatherman, and I work for the Treasure Valley Family YMCA. My role with the association is a little bit of everything, but I work mostly with our 65 and older demographic. So my job as a member experience coordinator is to really find programming opportunities for this demographic. It's our fastest growing membership across the association, which I'll talk more about later. So really wanting to just making sure that this demographic, our aging population, has a place here at the Y. A little bit about me. I'm from the Treasure Valley. I went to University of Idaho for my undergrad degree in exercise science and my master's degree in healthcare administration from Eastern Washington. I started my work journey, my career journey at St. Luke's Rehab Hospital, formerly Elks, where I worked in inpatient neuro rehab. So we saw a lot of people from our community recovering from strokes, spinal cord injuries, brain injuries, I started with the help of one of the physical therapists there, our outpatient program for people with Parkinson's. So I instructed 2 classes, exercise classes there. From there, I moved into senior living. So I had a little bit of a pivot into senior living. I really wanted to do quality of life care. So I did so over in memory care, skilled nursing, and assisted living community. I was there for about 6 years, teaching exercise classes and really just connecting people to resources in that community so that they could continue to live out their passions and interest and staying as mobile and upright as and engaged as possible. After senior living, I took a little hiatus and was a stay-at-home dad for a little bit, where I was working heavily on fall prevention with my 2 little boys. And so when this position is brand new, so I've been starting it from the ground up with the association. And so I've been very fortunate to have this come across my plate. And I feel like this role with the Y has really encompassed all of my passions and interests with working with our aging population, making sure they have a space to be included and can participate in the programs of interest and do so safely, but also just making sure that they have the resources to stay healthy and engaged and prevent some of those falls. So that's a lot about me. So let's move into the next slide. Okay. I really like this infographic. This really showcases what we're seeing across the US, and the increase in number of older adults in the United States is unprecedented. In 2019, 54.1 million US adults were 65 or older, representing 16% of the population, or more than 1 in 7 Americans. By 2040, the number of older adults is expected to reach 80.8 million. By 2060, it will reach 94.7 million. Older adults will make up nearly 25% of our US population. So if you look at the infographic on the right, you will see that really we were sort of a pyramid where you would have, the majority of our population would be in that 0 to 18 years old, and then decrease as we aged. But now, we're really moving from a from a pyramid more to a pillar, where there's going to be less diversity in those age demographics, and we're going to see a lot of similarities in numbers across each age. So there's some potential concerns with that figure. Obviously, as we have more people getting older and less children, lack of workforce aged people to care for our older adults, there will be a higher prevalence of chronic conditions, as we'll talk about in a little bit, and the numbers around chronic conditions, and how as we age, those become more prevalent. And then really the impact on the healthcare industry. So what this will mean with finances and increase in diagnoses and resources, lack of caregivers. So our role here at the YMCA as a community center for the Treasure Valley is really trying to promote preventative health measures so that we can stay active, and we can really make sure that as our members and our community members are aging, that they can do so healthy, so that we will see less fall risks, less hopeful chronic conditions, or at least have resources that with those chronic conditions, we can provide resources for them. So next slide. So an aging nation and fall. The United States, over 14 million, or 1 in 4 adults aged 65 and older, report falling each year. Not all falls result in injury. About 30% of those who do fall report an injury that required medical treatment or restricted their activity for at least 1 day. That's estimated around 9 million fall injuries. So every 20 minutes, an older adult passes away from a fall. 1 in 4 older Americans fall every year. They're the leading cause of injury-related death among adults ages 65 and older, and the fall death rate is increasing. It increased by 41% from 2012 to 78% in 2021. So each year, millions of older people 65 and older fall. So this is a big concern. And like Aaron set up so well, there's so many reasons why people are falling. It's not just people's physical health, but emotional health, their access to resources, the safe environment, and making sure that our communities are inclusive, and that we have appropriate measures into our spaces that folks can come and be safe and do so. So go ahead and go to the next slide. We'll talk about, I briefly mentioned this chronic condition numbers. So take a look at these numbers here. 6 in 10 adults in the US have a chronic disease. 4 in 10 have 2 or more. So aging really increases the risk of chronic diseases, specifically numbers around dementias, heart disease, type 2 diabetes, arthritis, and cancer. So those are the nation's leading drivers of illness, disability, death, and healthcare costs are our chronic conditions. That 64% that's circling there, 65 and older, 2 or more have a chronic condition. So going back to what that means as our resources and that pillar model of our demographic, there's some concerns around how are we going to take care of this? How are we going to take care of these people that are having these chronic conditions? And then ultimately financially as well. So what is that going to do to our resources? As people live longer, they're more likely to develop and accumulate chronic diseases over time. If they have risk factors such as age-related physiological changes, environmental exposures, lifestyle behaviors. So go ahead and go to the next slide. Thank you. So from chronic conditions, again, like we were talking about, we have that as a concern. Folks with chronic conditions will oftentimes have a higher prevalence of falls due to their diagnosis. So that's, some of that physical. Now moving into that emotional, that mental health. Let's talk about it a little bit. Social isolation and loneliness. Social isolation and loneliness among older people is growing. Loneliness is a little bit different. It's the pain we feel when our social connections do not meet our needs. And that social isolation is the state of having a smaller number of social contacts, which may then contribute to loneliness. Social isolation and loneliness affect people of all ages. 25% of older people are socially isolated. That's quite a bit. 5 of 15 of adolescents experience loneliness. Next slide. Again, some more numbers around these. Up to 50% increase in risk of developing dementia. 25% increase in risk of early death. Up to 30% increase in risk of stroke and cardiovascular disease. Loneliness and social isolation is a huge health risk, have serious health consequences. Their health risks are comparable to smoking, daily excessive drinking, and obesity. This is an area that I feel is oftentimes not talked about or worked on, especially when I came to the YMCA, knowing that this was going to be my demographic to focus in on. I knew that we had a lot of exercise classes, and I knew that we had a really great participation in them. But what were the other outlets? What were the resources that we were doing to focus in on this social isolation and loneliness? And I have some pretty good numbers around what we were seeing too as an association, but I imagine that's pretty typical across the globe, really. Go ahead and go to the next slide. Thank you. So like I touched on briefly a little bit, aging nation and then what the impact is on our services and navigating the challenges of an aging society. About 8 in 10 older adults struggle to use medical documents like forms or charts, which could make it harder for them to make well-informed decisions. Most older adults in the United States, like we talked about, have a chronic health condition. Making access to affordable and quality care really needs to be our priority as a community. And then obviously the lack of healthcare options in rural areas, higher out-of-pocket costs and transitions from insurances. And as mobility decreases with age, accessible neighborhoods and built environments with convenient access to community centers, grocery stores, anywhere places to get active become increasingly important. So those big, we're needing more complex care. The quality of care is maybe not as strong, or accessibility to these resources aren't always great. And then with the increase of cost, this is not a good process that we're looking at here. So go ahead and go to the next slide. According to the World Health Organization, the global health workforce was 43.5 million in 2018 and is projected to grow to 53 million by 2030. Unfortunately, this still falls short of the estimated demand of 80 million by 2030. So there's a real big global shortfall of about 18 million health workers, and mostly, unfortunately, in our low and middle income countries. In the US, a study by the Association of American Medical Colleges predicts a shortage of up to 139,000 physicians by 2033. So we can obviously imagine what that means and how that affects access to care, quality, the cost, as well as just the general health outcomes and the satisfaction of our population. So what we need to do is start really focusing again more on preventative care and what we can do to live healthier, stay upright, have less falls. And so let's go to the next slide. I think we're good. I think we've talked enough about that. Let's talk about what the Y is doing and what our association. So with our chronic condition specifically, the YMCA does a lot of wonderful evidence-based health interventions. These are anything from arthritis and joint health. We teach exercise classes around. We have oncology recovery, which is for cancer survivors. We work a lot with our population who has Parkinson's with teaching exercise classes, and a bunch of partnerships with communities and businesses in our Treasure Valley to help provide resources for this demographic. We have partnerships again with St. Luke's for Wellness Passport. We do education around diabetes, Alzheimer's, and dementia. So those are really our areas that we focus on with our evidence-based health interventions. Go ahead and go to the next. So the social determinants of health, as many of you might already know, are the conditions and the environments where people are born, live, learn, work, play, worship, age, that affect a wide range of health functioning and quality of life, of outcomes and risks. The social determinants of health really have a major impact on our health. So the well-being and quality of life, they significantly affect our chances of staying healthy as we age. Issues affecting the aging population in our community: chronic disease, depression, social isolation, access to resources, homelessness, or living on fixed incomes, and transportation barriers. Next slide, please. As a number of individuals living into their 80s and 90s and beyond, this increases dramatically. Focus has shifted from extending lifespan to really enhancing the quality of life in these additional years. The shift would not only have an impact on the general health of our population, but it would also have a positive financial impact, like I had mentioned previously. A 2013, so it was a little bit ago, conducted by Goldman, estimated that a widespread delayed aging would save the US $7.1 trillion by 2060. Yeah, that's a staggering number, and who's to say yes, but I think it just really points again to the importance of creating age-friendly environments and making sure that our aging population can age well in place and have personal growth opportunities, feel included, contribute to the community, enjoy independence and good health. So really making sure that our spaces in our community are age-friendly. And what does that mean? Age-friendly community offers supportive environment that helps residents grow older actively within their families, neighborhoods, civil society, offers extensive opportunities for their participation in the community. And in addition, age-friendly cities or communities optimize opportunities for health, participation, and security in order to enhance, again, that quality of life. Go ahead and go to the next slide. As a team member of a community center, really it's a big part of our role is creating an age-friendly environment. So we need to make sure that our resources here at the YMCA, or in general in Treasure Valley, are affordable, assisting in removing those financial resource barriers. How do we do that? The Y specifically, and a lot of gyms and community centers have Medicare Advantage plans, the third-party pay programs we call them, with Silver and Fit, Silver Sneakers, Renew Active. These are all supplemental programs through their insurance company that allows them to be a member at a place where they can really focus on their health and wellness. So this has been a really great step forward, and we've seen some really big numbers increasing. And now at the Y, our 65 and older and our third-party pay members specifically is our fastest growing membership across the association. Almost all Medicare Advantage members, 98%, were in plans that covered some fitness benefits in 2022, which is great. So for the Y specifically, in December of 2013, we had just under 4,000 units that made up our 65 plus members. And that's about 10 years ago. And then in 2018, we increased that to 6,700. And then just in April of 2024, we had just under 10,000 units of 65 plus members. So this was made the same as above, but so that's an increase of 155% versus 10 years ago, and an increase in 49% versus 5 years ago. So some pretty staggering numbers, but here's maybe the caveat a little bit, if you will. Our 65 plus membership is about 35% of our total membership. But when they started this role, some numbers that I quickly was tuned into when I started was that, why are we focusing in on this effort? One, because it's our fastest growing membership, and it's about 35% of our total membership, around, just under 30,000 total membership. But unfortunately, around 60% of our 65 plus membership wasn't using their membership at all. They weren't coming to the Y a single time. So they have this benefit. They come to the Y, they're excited to maybe work out, or they say, I'd like to use this benefit that I'm paying for in my supplemental insurance. And they get signed up. Well, then we don't ever see them again. So that could be a couple of reasons. Motivation, it could be inclusion, not feeling included. It could be access to resources. It could be transportation. There is a concern around that. And so I would say that that's probably pretty consistent, but my role was to quickly tune into that number and figure out why they weren't coming. So what was it that they came, they got this membership, and then we never saw them again? 64% is a pretty large number of folks not coming and using those resources. And that's what we want here as a nonprofit. We want these people to be engaged and active. So what do we need to be doing differently to make sure that they're being physically healthy, socially engaged, and, ultimately contributing back and doing what they love to do? So go ahead and go to the next slide. Great. Okay. Again, really, it's our job to be accessible, provide resources for safe and reliable transportation, making sure that our place is inclusive, partnering with other organizations. Like Aaron said, there's so many folks that are doing similar things, but we're not communicating to one another. We need to make sure that we're sharing these resources, not only to our fellow partners that are, combating this, but also with our community members and our members. And so making sure that we're just doing a better job about partnering with people, creating the awareness, and then ultimately extending that invitation. So go ahead and go to the next slide. This was don't need to talk too much about this, but really just a pretty interesting thing is obviously, so I have, like I mentioned, a couple kids, and I remember my oldest graduating from pre-K, and they asking, what do you want to be when you grow up? And it's such a common question that we get asked, what do you want to be when you grow up? Or just really something that pops up in casual conversations with friends or acquaintances is, what do you do for work? What do you do for at school? There's just a lot of pressure or identity attached to what you did as a career or what, and so when we retire and we're no longer a teacher or a nurse or accountant, whatever it may be, folks feel like their purpose in life or that identity is no longer there, and they're having to sort of recreate themselves. Having that purpose in life is related to having less depression, anxiety, and other negative effects. A systematic review of 10 studies showed that a high score on purpose in life was associated with a 17% reduced risk of all-cause mortality and cardiovascular events. So again, here at the Y, I'll talk a little bit more about it in the next couple of slides, but we really want to be able to assist in this area, is maybe recreating that purpose in life. And now that they're retired, what can we be doing to make sure that they're engaged and feeling like they have a purpose and are, doing what they're passionate about? Or so go to the next slide. Great. So Forever Well. So when I started last July at the Y, I was coming to work and I was like, there's these active older adults, they're here, they're busy, they're exercising. But if you don't, but I went on our website and couldn't find, as a newbie to the association, couldn't find where these classes were. I couldn't find like the information. If you didn't go through our doors, I didn't know that these resources were happening. So my first effort was to create sort of an identity of across the association of Forever Well, which really was very inclusive. We call them seniors, we call them active older adults. This kind of just takes that identity factor out of it a little bit, and just is really for anyone who is looking for a place to start, or who is an active older adult, or just anyone looking to really find their, start their health journey. So this was also just a really great way to be able to put all of our programs that are pertinent in this effort into one space, instead of having to sift through so many things that the Y does, which is great stuff. So go ahead and go to the next slide. Okay. So with Forever Well, our focus is helping older adults improve their overall health and well-being holistically. In addition to concentrating on physical health, we aim to deepen social engagement between the Y and older adults. The meaningful relationships formed through social support of the Y will help reduce social isolation and improve quality of life. So really just focusing on that mind, body, and spirit, community, nature aspects of well-being, and trying to kind of squash that stigma of us being a gym and swim. You go to the Y to exercise, and that's what you do. So really creating some diversity in programming to make sure that we could meet people where they're at, and maybe I'm not one that wants to go and exercise and do a bunch of strength training or participate in group exercise. I really want to get out of my house. I need to get out of my house. And then I see a cribbage game popped up at the Y, and people are playing cribbage. I like to play cards. Let's go play cards. So this gives us an opportunity to meet people where they're at, what they enjoy doing. And then when they come for card playing, or maybe a presentation, they meet people, they build relationships. Now they're coming because Kyle invited them to his exercise class that he likes to go to. And now they have a friend. Now they can feel a little more included. They have accountability now with a friend inviting them to come. And now they're coming for cribbage on Mondays, and they go into silver sneakers on Tuesday for exercise class. So really, that's the philosophy and the idea behind this Forever Well movement at the Y. Go ahead and go to the next slide. So I'm not at this age yet. So really the best way to create programs is to have sort of a co-creation model. So I need help. So I've been doing, we have volunteers at each branch that belong to this demographic, and their role is to really sort of co-create with me. So co-creation provides that purpose, that sense of belonging in the community. And so they are a team of ambassadors that really are excited about creating programs. And they work with me to get these programs on the calendars every month. It's a really great way for them to connect people to people, people to resources, and ensure that our membership continues to have that sense of belonging and feel connected to their community as well. So some type of, go ahead and go to the next slide. Thank you. So connecting people to people and people to resources, partnerships. With our Forever Well programming, we really are, we do arts and crafts, we do games, social activities. We have a ton of partnerships in the community with universities, learning centers, Medicare information. We like to have our members share their, passions and interests, and we love to have support groups, nutrition classes, coffee, creative writing, bingo, really just making sure that we're meeting people where they're at and finding what their resources are to keep them engaged in programs of interest. And so that's really what the Y is doing in their Forever Well programming, to make sure that people are getting out of their homes and building relationships and community connections, and doing so safely. And because we know the benefits of that, getting out of your home, and so and really how that helps really your health and well-being on a holistic approach, and reducing hopefully some of those falls. So that's all I have. I want to make sure that there is time for any wrap up and questions. So thank you all so much, and hopefully you learned a little bit, and come check us out at the Y, and I'd be happy to talk more about it.
Thank you so much, Kyle. I learn something more every time I hear from you. So we're going to hopefully have some time for a Q&A. So stay tuned. In the meantime, Todd, if you could go to our next slide for me, please. Kyle, of course, did a good job of summarizing things up. And when I first met Kyle, I learned that term swim and gym. And that really was my concept of, what I thought the Y was. So I have expanded my knowledge, and that's why we're sharing it with all of you as well. The other thing that he mentioned real quickly was just, people that are retired. And one of the sayings I have learned to love is, instead of telling people what we are retiring from, which is what we usually say, I'm retiring from the Idaho Commission on Aging, where I was a program specialist. We need to start thinking more in terms of, what are you retiring to? And that's really what Kyle was talking about, is that purpose in life, and what are you going to do with all of the knowledge and skills and things that you have had in your life when you retire, and how you can continue to share that. So as Kyle mentioned, the first thing you kind of need to do is just say, am I as physically active and socially engaged as I want to be? And hopefully the answer to that is yes. But if it's not, or if you'd like to see what else there can be, identify what you enjoy, other than that job. What other kinds of things have you maybe even had to give up because of your job, because there's not enough hours in the day and now you have time to do that? Then find a group or organization that provides the people and the types of activities that you enjoy doing, and get involved and get active to the best of your ability. Now, that's going to mean something different for everybody, but I hated to hear the statistic of how many people have a Y membership, but they don't even use it. So, signing up is one thing, then actually doing it is another thing. But part of that is getting a friend or neighbor involved, maybe somebody that you know that isn't as socially engaged as they should be. They don't leave their house a lot. Maybe you can take them along to the Y, to an event or an activity, and get them involved as well. And then, of course, we didn't mention it specifically, but both my programs and the one that Kyle oversees, a lot of them utilize volunteers. There's always something that can be done to help build these types of things in our communities, and that's important. So let's go to our next slide. Since we know that our environment is a significant cause of falls, I just wanted to take a moment to remind you that we are holding another seminar this Wednesday, day after tomorrow, called Recognizing and Removing Trip Hazards at Home. It's presented with our partner Habitat for Humanity here in the Treasure Valley. It is Wednesday, like I said, the 25th, from 11 a.m. to noon Mountain Daylight Time. That's 10 a.m. Pacific Daylight Time if you're joining us from up north. The registration link is the same website I gave you earlier for all of our information, aging.idaho.gov/falls, FALLS. Next slide, please. So what is the takeaway from everything that we've talked about? Being active and socially engaged helps us prevent what many call the normal signs of aging. I hate that word. Falls and loneliness are not part of normal aging. So we just need to get help, find and use the resources that we have to engage us socially, as well as getting us out and being physically active. Those are the two best things you can do to keep yourself aging well, aging healthy, all of those things that I think all of us are looking forward to. Next page, please. So we have just a few minutes, which is just that Kyle, you mentioned the social determinants of health. That's kind of the fancy word that we in the biz use to talk about the fact that there are multiple things that keep people emotionally, physically, and socially healthy. And we've kind of touched on some of those. I would like to remind you to contact your area agencies on aging for many of the programs that are not what we've been talking about here today. But if you need help with things like congregate meals or home delivered meals, if you are interested in taking one of the workshops that some of which are held at the Y, like diabetes or chronic pain, arthritis, those types of programs are being provided to help you better manage those chronic conditions that we mentioned, most people have when they get to a certain age, and many people have multiple chronic conditions, and those certainly can impact your health. All of their information is on our website as well. So let's see if we can go to our Q&A. So Todd has been our Zombie behind the scenes today, running the slideshow and doing our recording. Todd, do we have any questions today?
We have one question. I think Kyle is in the process of answering, perhaps. But the question is, on the Forever Well, you mentioned all branches and partnerships. Are locations spread out in the Treasure Valley?
Yeah, good. That's a great question. I did see that in the chat, so thanks for bringing it up. I do want to mention that. So the YMCA has a branch at the West Boise City Aquatics. They have a downtown branch, which we're also getting a new one built, 2026 maybe. And then we have one out in Caldwell and one in South Meridian, which is our Tomlinson Center. And then actually just in May, myself and a colleague, we opened up the YMCA Community Hub right downtown on 8th and Franklin, which is really our focus in this Forever Well effort. So it was a big push to get this space open pretty quickly. We do a lot of our evidence-based health classes here, a lot of our partnerships. Like Aaron mentioned, we've been doing chronic pain workshops. Living Well with Diabetes with her organization. We have other partnerships just throughout the community that we offer this space to really, promote that community health efforts. And then also with that Forever Well. So Forever Well is association-wide effort. So that means it takes place at every branch. But because it's so new and I'm one person, we're really doing a lot of those efforts here at the community hub. And then from there, it'll branch out to the other locations. But anyone that's a community member or a Y member can come to any of the branches and utilize their resources. So definitely, if you are a Y member, come check out the community hub. Even if you're not, come check it out. I'd love to tour you of the space and talk a little bit more about Forever Well. So it will be more of a staple in each branch, hopefully soon. But right now we're really just building it at the community hub and starting those beginning phases in each branch. So hopefully that answers your
And
question.
can I add or ask something, I guess, in there, which is the Commission on Aging and our wellness workshops are typically led by peer volunteers. You do not, as a matter of fact, we don't want people that are nurses, doctors, etc. We want just normal people. We can train you and certify you. And we are always looking for volunteers to do that. The requirement is just that you teach one workshop per year, but we'd love to have you do more. And I don't want to speak for you, Kyle, but are you guys ever looking for volunteer leaders for any of your classes and workshops?
Yeah, absolutely. Again, kind of back to that purpose in life slide, and my my efforts across the association is really to get these volunteers, and we call them ambassadors, of folks that are really interested in providing workshops and continuing to do what they maybe did as a career, whatever that might be, and sharing those resources and their wisdom. And so we're always looking for volunteers. It's the best way I only know so much. And so my favorite thing is to connect people to people or people to resources. I like to say that a lot, I know. But really that's how you get a strong program. That's how you get retention and people engaged when they're passionate about it and they themselves are involved in it and have a little more skin in the game, if you will. So we're always looking for volunteers to help with meeting the needs of our community members and helping fill those gaps in healthcare or whatever that might look like. So we love partnerships and
Yes.
volunteers. Absolutely.
So you guys have Kyle's information in a couple of places. It's on his profile here in the Zoom events. It's also in the slides. And you have the Idaho Commission on Aging information. And you can contact, I would assume, either one of us, your local area agency on aging, and just tell them, hey, I want to be helpful and I want to learn how to provide a workshop or talking, Todd.
Say again.
Did we get another question?
No, we got a great thank you from Mike Hershey.
Perfect. Thank you, Mike. I wanted to mention, of course, Kyle is with the Y. And Kyle, do you have other Y facilities outside of the Treasure Valley in Idaho?
Yes. Great question. And I unfortunately don't know where all the Ys are. There are a lot of them, not necessarily in Idaho, but I know for sure there is one in the Wood River area. So Sun Valley.
Okay.
I'm not sure, Todd, is there any up north?
Not that I'm aware of.
Yeah. And maybe Eastern Idaho, there might be one as well. So Magic Valley.
Well,
area.
if you don't, yeah. And you can always Google it.
Yeah.
Or contact Kyle.
I can find one. I'll find one for you.
We do want to also mention that what we're talking about here is the ability to come to one place to get multiple services, multiple resources. And the Y certainly does that, like we said, far beyond swim and gym. The other thing to think of are your senior centers. We have a bunch of senior centers in every county around our state, part of which is very rural, so it's hard to find programs, but all of our senior centers offer programs as well. Now, depending on the size, they do, maybe a limited number of things, but most of them usually offer congregate meals, which technically are free of charge. You can make a donation if you like, but you can come and be with people that way. And then they also usually have other types of social activities. If it's not types of presentations or education, then it's, playing games, doing bingo, playing cards. So don't forget your senior centers as a place where you can get this type of social engagement and interaction as well. And many of them, for example, the Boise Dick Ridley Senior Center, does have gym equipment and those kinds of things. But if you don't have a Y in your area, please look for other options. Of course, religious organizations often do social things and physical activities as well. So there are a lot of ways to do what we're talking about. And the one-stop shop is, primarily just because you can optimize it and get it all done in one place, which is sometimes easier. We do know that transportation can be challenging, especially for people that don't live in a place with public transportation. Kyle, I don't believe the Y probably provides transportation, or do you?
Only in our youth development programs do we have transportation. Okay. Yeah, we depend heavily on access bus system.
Yes. Okay.
Yeah.
If you're not familiar with the access system, that would be for people with any type of a disability or handicap. They can do that. Another thing is, maybe that's a way to get friends and neighbors together. If there's more than one of you and one of you is able to drive or has somebody who can drive, contact your area agency on aging and see if they can perhaps help provide transportation to get you to a senior center, a Y, other types of those social events to get you out and active. Have we received any other questions?
No, we have not.
All right, well, that's good because we are just about out of time. So I did want to remind you your area agencies on aging are a perfect resource for your local resources. And finally, I want to give a big thank you to everybody. First of all, to Kyle, of course, for making time in his busy schedule. They did a whole week-long event last week, and I know he's probably pretty tuckered out after all of that. So thank you for being here and sharing your information. It's very, very useful and helpful. Thank you to Todd, who is our Zombie and makes all of this wonderful stuff happen. And of course, thanks to all of you who made time to be here today. We do have our upcoming seminars, let's see, we've got two more, but all of the recordings will also be available. So keep us in mind, check out the website. That's all for today. Thank you so much for joining us, and please stay safe and falls free.
Thank you, everyone.
And stop the recording, please, Todd.